All right. Thank you very much for being here for this important hearing. And I thank Senator Lee, especially, and his staff for helping us to plan and spearhead this hearing. And today we're going to be focusing, and I also thank Senator Durbin, the chairman, for being here already. And it couldn't be a more important and timely topic. Today we're going to focus on the impact of hospital consolidation on patients, healthcare costs, healthcare workers, and healthcare innovation. All Americans deserve access to quality, affordable healthcare, and we know there's a lot of work to make that a reality. We can lower costs to consumers by addressing skyrocketing prescription drug prices. To bring down those prices, I've introduced bipartisan legislation to expand access to cost-saving generic drugs, deter pharmaceutical companies. That's a bill that Senator Grassley and I have, from blocking cheaper generic alternatives. And I know Senator Lee has actually done work on this as well with the CREATES Act. Also allowing personal importation of more affordable drugs from Canada. I believe we also should allow Medicare to negotiate for the best possible price for prescription drugs. Healthcare is a personal matter for everyone, and that's why we need to look at hospital competition and consolidation. Hospitals are a growing area of cost in our healthcare system. It's about $1 of every $3 we spend on healthcare in this country. The expenditures for hospitals hit $1.2 trillion in 2019, and that figure is growing fast, up by more than 6% compared to the year before. We can't address the challenge of healthcare costs in this country without also including hospitals in the conversation. That's why we're here today. The rise in concentration in the American economy goes across industries, from cat food to caskets, and hospitals are no exception. We have had about 1,600 hospital mergers in this country in the last 20 years. 90% of all metropolitan areas have highly concentrated hospital markets. We've also seen hospitals buying physician practices at a fast pace, and now about 1/3 of all doctors work for a hospital. Many hospitals actually charge more for doctor services when they can say they own the doctor's practices. That results, of course, in higher costs. Hospital mergers can reduce choices for patients about where to receive the care, as the merging hospitals align with one powerful insurer or another. That can suddenly leave those who have developed meaningful relationships with their doctors to fend for themselves. When someone is sick, one of the last things they want to hear is that their hospital has been bought and they no longer have access to the doctors they trust who have been treating them for years. These are real human costs, and we need to talk about how they relate to hospital consolidation and market power, and especially if you have more and more doctors working for the hospitals, you could see that happening more easily. I'm particularly grateful to have Beth McCracken with us as a witness today. Beth is a cancer patient from Pennsylvania who lost access to her doctors in the aftermath of a turf dispute involving a hospital acquisition, causing her and her family incredible stress during a difficult time and quite possibly delaying her diagnosis until her cancer had progressed. Beth, we look forward to hearing from you remotely, and thank you for being with us today and giving patients a voice in this important conversation. Financial costs are important as well, but it is the human costs that I feel particularly strongly about, that with the antitrust and competition policy problems associated with hospital mergers. We know there can be advantages to hospitals merging, like the possibility of reducing overhead costs. The research does show, however, that hospital mergers can result in higher prices. A 2018 study found that hospital prices are 12% higher in monopoly markets compared to those with 4 or more competing hospitals. Mergers of hospitals in the same market raised prices by an average of 6%. Hospital mergers can also reduce incentives to innovate in the way they deliver care, as Dr. Miller will explain in his testimony. Hospital systems are major employers in many communities. Sometimes they are the largest employer. The Bureau of Labor Statistics estimates that over 5 million Americans work in hospitals. We must also consider the effects of hospital consolidation on healthcare workers. A recent economic study found that for the mergers that increased hospital concentration the most, wages for nursing and pharmacy workers were 6.8% lower than they would have been absent the merger. As in other markets, consolidation can drive a vicious cycle. Insurers merge, resulting in bargaining power against hospitals. That pressures the hospitals to merge too, so they can combat the power of insurers. And it repeats and repeats, a vicious cycle. It's a cycle of consolidation, and we see it throughout the economy as one side tries to accumulate power through mergers, only to be thwarted by the response of its trading partners to merge as well. In any case, we must make sure, first of all, that our federal agencies have the resources to investigate these types of cases. I'm very pleased, and I want to thank Senator Durbin, that the bill Senator Grassley and I have to change the merger fee structure passed on a voice vote out of the Senate Judiciary Committee just last week. And it will give our agencies, the Department of Justice, to Antitrust, as well as FTC, additional resources that they need. While taking on Facebook and Google, the biggest companies the world has ever known, trillion and trillion dollar companies, they can't then also look at important topics like healthcare consolidation or online travel or pharmaceuticals or so many other areas. We also need to reform our antitrust laws. When mergers are anti-competitive, they must be stopped. That's why I have proposed legislation to reform merger law and make it easier to stop anti-competitive merger before their effects hurt consumers in the form of higher costs or lower quality care. We also have to be able to look backwards. We can do that now. That's what the breakup of AT&T was about. However, we can make it easier to look backwards by giving our agencies the tools they need to do it. That's also part of my bill that is industry-wide. So we now are going to explore these issues in the hearing. I want to thank our witnesses, but first I'd like to turn it over to Senator Lee for his opening remarks. Senator Lee.